Hi there, good evening. My name is Charlotte Cady, and today I will be talking about the ethics of evidence-based practice within counseling. So we'll go ahead and start with the definition of evidence-based practice. The APA Presidential Task Force describes it as the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. Some advantages of evidence-based practice. It provides credibility and evidence for efficacy of talk therapy. Scientific evidence is really important to justify our field of counseling in order to get insurance reimbursement and overall advocate for the profession. And that's my next point, helping advocate for the profession. It also provides a reliable and applicable framework for effective treatment across therapists. Many therapists have different approaches and personalities, and evidence-based practice might be able to bridge the gap between therapists and make sure there's some kind of continuity in care and some kind of baseline for efficacy. And with that, it's more easily measurable for client improvement. Evidence-based practice gives us some kind of scientific framework to measure client improvement rather than just guessing. Some disadvantages of evidence-based practice, I found quite a bit. For one, it limits types of care that may be beneficial for clients that are not as easy to replicate in research. Evidence-based practice leans heavily on cognitive behavioral therapy, which I personally am not the biggest fan of. I prefer more experiential approaches, and that's just my personality. And I imagine there's a lot of clients out there that also would not prefer to have CBT as the go-to. So that can ignore or limit treatment consideration of existential concerns or broader reasons for seeking help. Not everyone goes to therapy with specific goals, and maybe they just need somebody to talk to, and counseling should be able to assist with a broad range of concerns, and that will also limit the creativity and flexibility of the therapist if we're given specific guidelines for how to implement practice. It might limit that creativity that could be used to help clients and help the therapist feel empowered. And this also leads to assessment can feel rigid. I've gone through this myself where there's a formulaic process to assessment, and it kind of gets in the way of building that therapeutic rapport and feels less flexible than just going with the flow. And it might also limit treatment to CBT or other methods of the work that might not benefit everybody. And most of all, this is one of my biggest concerns, is that therapeutic relationship is most important and overall cannot be measured scientifically. We know that therapy works, but we're still trying to figure out why. And there's a lot that goes on in the healing process that can't be measured scientifically a lot of spiritual concerns, and just the way that science is and the way that therapy cannot really be explained in a lot of ways. And why evidence-based practice appeals to managed care systems. It can decrease the number of sessions to be effective, which saves the insurance companies money. And that's a really logistical and sensical reason to implement evidence-based practice. The insurance companies don't want to waste money on less effective therapies that might need more sessions to be effective, and that might also be more ethical for the client to not have the therapy drag on for longer than necessary. It requires highly specific goals, which is more easily obtained by implementing evidence-based practice. And this goes back to why are they going to therapy and why should we pay for it? And they will not pay for treatment without a specific diagnosis. And there we go back to requiring that highly specific diagnosis in order to be seen for treatment and get the therapy that we need. Some ethical issues regarding evidence-based practice. Treatment manuals that have been implemented may pathologize clients and fail to see the whole person. If we're looking at clients from a holistic perspective, a treatment manual is kind of demoralizing or dehumanizing the whole person. I would not prefer to be reduced into a manual. There is no manual for life, I think, and everybody is so different. So managed care clients are shown to have poorest outcomes, which I found really interesting. I'm not sure why that would be, but it should be evidence for having a less regimented view on evidence-based practice. Many treatments are shown to have similar efficacy, so even though some methods show higher promise than other ones, overall they all typically have a similar efficacy, and I think that's due to the therapeutic relationship being the vehicle for change. Also, it probably implements Eurocentric ideals, which perpetuates oppression for diverse groups. A lot of science that goes behind cognitive behavioral therapy and other modalities are often tested on white middle class men, let's say, and it does not take into account cultural differences. And along with that, the DSM is limited in its multicultural approach, and that's something that the field can work on and counselors can be aware of when making diagnosis. And it also limits adaptation to client needs. Therapists should always be aware of client needs and adapting their model and their framework to best meet the client, and that's not always going to be with a manual or with CBT or these specific frameworks. And those are my thoughts on evidence-based practice. I think assessment is great and treatment plans are great, give some direction, but there's also a lot of drawbacks to using evidence-based practice. I feel this in the music therapy field. We are also supposed to use evidence-based practice to the most of our ability, but there's also so many ways that it's limiting to like the potential that cannot be proved in science. So there are my references, and thank you so much for listening. Have a good night.